I'm Matty Zimmerman, and I'm presenting on Bennets fracture. So Bennets fracture was first described in 1882 by a guy named Bennett. Not much has really changed after he first described the injury or the rehab for it. It accounts for a third of all thumb fractures in adults, and is most commonly seen in adult males on their dominant hands. A Bennets fracture is the fracture at the base of the first metacarpal, and it's usually an avulsion fracture because of the muscle attachments there, and it can be associated with a subluxation as well. The mechanism of injury is usually an indirect force. It's caused by extension or abduction of the thumb, usually by falling, but it can also happen in car accidents, work injuries, and if you punch someone or something. Clinical presentation, so it usually has acute and severe pain right over the fracture site, swelling as well. It can show some bruising too. You have reduced thumb range of motion, tenderness over the site, reduced power of the thumb, inability to grip anything, weakness in the pincer grip, and it can have crepitus, and the thumb can look shorter depending on how far the thumb is displaced, and there can be instability when it's stressed. You can do fracture tests to diagnose it, but it's usually diagnosed with x-rays in the anterior-posterior view and oblique views. There's two different ways to treat it. You can do non-surgical and surgical. They don't really do non-surgical all that often on these because most of them are displaced too far, and they have to go in surgically and put it back in place. So they're only used for small avulsion fractures with minimal incongruency and instability. They're casted in a thumb spica, so it covers them from right below their elbow to up to their thumb joint. They're in there for up to 4 to 6 weeks, and they have to be carefully monitored with multiple x-rays during the healing process to make sure that the bone doesn't move out of place. If it has more than 1 millimeter of incongruency during healing process or right as it happens, you have to do it surgically. You use K-wire for a closed fixation and K-wire and or screws for an open fixation. They're casted after surgery from 4 to 6 weeks depending on how stable the joint is. And they're also monitored very closely with x-rays as well. For complications, studies have shown that there's not really good results with closed reduction methods, and there's a study that shows 26 years later there is a high incidence of joint degeneration and functional problems in the thumb joint. So you can get articular degeneration of the CMC joint depending on how much degree of articular incongruency there is. You have a chance of developing long-term arthritis, and if you don't rehab properly and early, you can lose range of motion.